For healthcare providers and organizations like APIN Public Health Initiatives working to end AIDS, ensuring that clients adhere to treatment is critical for achieving viral suppression and preventing drug resistance.
We work with patients and clients that cannot afford to go on holidays. When I mean holiday, cannot afford to go on drug holiday. They take these medicines every single day for the rest of their lives. And once they don't take those drugs, things happen. They fall sick, they might actually die. You have them, opportunistic infection comes in. So during COVID, there was lockdown. But luckily, we've been planning a couple of things and trying out a couple of things before then.
One of the strategies devised was differentiated service delivery, DSD.
What is differentiated service delivery? It's a client-centered care where you are looking at an approach where the patient's or the PLHIV's preferences, you are able to adapt it into your treatment. You understand? So you are discussing with them and you are allowing them to have some flexibility so that you don't overburden the health system. For instance, if you are supposed to have maybe 200 patients coming on an appointment, you end up maybe getting 50. You can see that the burden is lessened for the doctor.
Apart from easing the burden on the health system, DSD has several other benefits, including minimizing transport costs and time spent traveling to or visiting a health facility.
And you find the patient coming to the clinic every month to come and pick up medicines. It's taskful, it's expensive because patients had to pay transportation to come back and forth. And some of these patients come from several kilometers or miles to get to the clinic. And because of this coming back and forth every month, it kind of discourages patients from coming. So you find patients breaking their drug intake, not running out of medicines.
Our mẹ́fà ni àwa ní under community yẹn. Èmi ni head wọn ní gbà yẹn. Tí n bá ti gbọ́ pé mẹ́fẹ̀ẹ̀fà yẹn tí mo ti gather wọn jọ, tí mo ti gborúkọ wọn, tí mo ní phone number wọn lọ́wọ́. Màá ti pè wọ́n lórí phone pé hello, Miss Lágbájá báyìí. Ìjọba yìí ní clinic yín. Màá ti bá wọn gba oògùn. Tí n bá dẹ̀ ti wá sí facility lọ́dọ̀ wa ń bí, màá gba oògùn wọn ní ọjọ́ yẹn. Màá wá pè wọ́n pé mo ti gba oògùn ẹ pàdé mi ní community group wa o, kẹ́ wá gba oògùn yín. Tó bá dẹ̀ ti gbà lọ́wọ́ mi, tí n bá dẹ̀ ti kó fún wọn, màá sọ fún wọn pé another month báyìí ni wọ́n fún wa o, kẹ́ lè láǹfààní láti lè wá o. Ẹlòmíràn nínú wọn ní mo ṣe o, mo sì jọ́ ọ̀dà pé ó help àwọn pé ẹlòmíì ó ní business ní ibi iṣẹ́ tó ń tajà ní shop. Ẹlòmíì kẹ̀ tó jẹ́ oníṣẹ́ ìjọba kò máa ráyè ní ibi iṣẹ́ ní pé kíní pé ó máa tọrọ ilé ní pé mo fẹ́ lọ sí clinic lónìí, á ní kí ló ń lọ ṣe ní clinic gangan.
Another prong of the DSD strategy, which has also proved beneficial, is the community pharmacy system.
We know the way it is. Patients with HIV don't want everybody in the world to know that they are affected. So number one, they don't like to take permission from work. They don't like to go to the clinic. So they miss their drug. So we have this program, we work with the community pharmacists where we devolve some patients, meaning we ask some patients to pick up their medication from the community pharmacists. What they do is that the community pharmacists open 7 days a week, Mondays through Sundays. We know the hospitals don't work Mondays through Sundays. They can only pick up their medicines at a particular window. So with the community pharmacists, these drugs are with the community pharmacists. So you find the patient, when it's closest from work, goes to the community pharmacist to go and pick. Could be 7 o'clock in the morning, could be 9 o'clock in the evening.
Uvango chi pharmacy dosi don hachu kava hefle ndai ko aluya ja moto pe kila tavega shikema vaye la motsembele za yongunga ba yeve kasiva si chiayo kambula mena vese ese bango hochi akwala hipenu la kayomba kakavuchia Hachu. What via you made a lamb and a wood? Ah, come a vahe and go hopefully again. Nah, yeah, me da Lucia Qua, one more. It's a young wonga.
We started with 12 clients, and today we count in about 45 or more under the care. And definitely it shows that we have been able to retain and maintain the clients that have come to be part of this community pharmacy antiretroviral therapy model.
I really want to appreciate APIN for this initiative because it has helped. Either ways, it's very useful. It's useful to the pharmacy, the community pharmacy, and it's also useful to our clients who have been devolved to us.
A key benefit of the DSD strategy is that it preserves the privacy and confidentiality of the clients while ensuring that they have a regular supply of the life-saving antiretrovirals that they need.
Differentiated care delivery, and you find patients that will say, okay, I don't want you to know my house, I don't want you to know my community. So we agree on a particular day at a particular time. We all meet at a particular bus stop, or we meet at the village square under a tree as if you're having a meeting. You bring in their drugs. That's a cohort of people. We receive our drugs, we go a different way. You don't know my address because I don't want you coming to my house. I don't want people in my neighborhood to know that I'm on ARVs. I don't want them to see. So we meet in a particular place, not one-on-one, but a group of people. We agree that this is the way and how we are going to be taking our medication, and that has worked for us pretty well.
As Nigeria continues to strive towards epidemic control, APIN remains committed to delivering quality, comprehensive HIV services that are tailored to the needs of the clients.
That is the joy we have in this job. You see somebody that has lost hope, that is doing their will or praying to God, putting their things in order, putting all their houses or homes in order. And in 2 months, with good counseling, with good care, doing their viral load, taking their medication, living positively, and they bounce back and they are good to go. That is, you can't quantify that.